All right, well, good afternoon, and thank you all for being here at City Hall on the roof as we are practicing, of course, social distancing. Let me start by thanking all of our employees, all of our people who have truly been on the front lines of this crisis, from our first responders, all of our healthcare providers, and our journalists who are really working over and above to get good information out there, and we really do appreciate that. And I want to especially thank all of our residents and businesses who have been vigilant in complying with the proclamation that I moved forward with on the 15th of this month. I am issuing a stay home. I am issuing a stay home mandate. It's a guidance document from the health department that takes its legal force from the proclamation that I issued on March 15th, which was Monday, March 15th of this week. We are hereby mandating that residents stay home whenever possible, going out only for critical needs only. We are telling our people and our businesses to stay home. And we've been doing this, but more aggressively is what we are about this afternoon. Across the country, as I've talked with and worked through many of these issues affiliated with this crisis, with my brother and sister mayors, again, across the country, we're saying the same thing. The more people who stay home, the more lives that we will save. If you don't have any essential function or cannot safely maintain social distancing, you need to stay at home. We need everyone to pay attention, and we need everyone to comply. Pay attention and comply. Don't look for ways for the rules to not apply to you. Do not look for ways to be an exception. Stay home. If there are any gray areas, err on the side of caution. Stay home. You can find ways to work from home. They say move to minimum basic operations. City Hall is changing how we operate as well. The work of the government goes on, and it will go on, but we are moving towards limited functions and operations. Again, we are moving towards limited functions and operations. Currently, I have my directors of every single department evaluating how to provide basic city services to the public, to not close government, but limit our personnel. That's what we're working on and working towards. We are evaluating expanding our civil leave policy. We continue to look at all options to keep payroll moving and keep the city government rolling and also solvent. As I came to you not too long ago, I talked very specifically about the impacts to our operating budget, especially as we relaxed the remittance of sales tax to the city, which the deadline is today. But understanding, relaxing those requirements, it means that we will take a significant hit to our operating budget, which is primarily made up of sales tax revenue. So we're depending on our data and our cash position to determine the steps that we will take as government, but continuing to serve our residents and providing basic city services. As we make changes, we expect businesses absolutely to do the same. Find ways to perform the minimum basic operations and keep people at home. Critical businesses are expected to remain open, which are and have been embedded in the proclamation that was issued. Healthcare providers, groceries, pharmacists, takeout and drive-through restaurants, construction and infrastructure work, banks, news media, all of these are spelled out in the guidance document that we are releasing this afternoon. We want to take this opportunity to thank all of our restaurants, the many of them, for their compliance and for their efforts of doing the right thing, while they're also focusing on keeping their employees employed, providing to-go meals for laid off employees. They're doing this. Some restaurants have not heeded these restrictions, and make no mistake about it, we have been enforcing, and they're subject to losing their permit to operate in the city of New Orleans. That can go beyond the crises of COVID-19. Complying with these mandates is the only way to help flatten the curve, and we have yet to see our curve. Restaurants are essential services for our residents as well, who rely on them from day to day. We understand that. Industry workers actively performing their duties will be able to travel to and from work, even with the RTA limiting to essential travel only, which is aligned with our workforce. We expect restaurants to follow these guidelines, limit gatherings, and ask guests to call ahead as relates to takeout. Walk-up ordering is not permitted. Don't allow guests picking up food to be congregant, to create these gatherings. We have to take care of our people, and we have to take care of each other. Being mindful of city employees, again, is a part of what we're doing. Therefore, we're moving to limited service. Being responsible with those in our care. And I've been hearing from the advocates, even loud and clear, specifically around our juveniles that are being housed at the JJIC. We are ensuring health and safety of all of our young people, again, in our custody and under our care. We're limiting access to the facility. This has been going on. We're screening our staff and our youth twice a day. That will continue to go on. JJIC is working closely with the courts and defense attorneys to reduce the population of non-violent offenders. Now, I understand that juvenile court has closed, but at the same time, I do understand that this is not good practice as relates to the services that we have to provide our people, and particularly our families. I'm told, and the administration will continue to work with our juvenile court leadership on a virtual system. This was expected to be in place as indicated by juvenile court on yesterday. That did not happen. However, we're going to make sure, meaning my administration and working with juvenile court, to get the services that we need, because it will put a strain on JJIC. Make no mistake about that. The full text of the health department guidance is being distributed to the media after this avail. And whoever needs it, of course, we'll get it out there on every one of our platforms as well. The mandate is clear: stay at home. And it means exactly that: stay home. Don't look for excuses or exceptions. Create solutions for your businesses and for our families that keep people away from each other and working from home. I'm going to turn it over now to Dr. Jennifer Vegno, who you have come to know very well as our leader and director of our health department within the city government. So with that, Dr. Vegno.
Thank you, Mayor. As you know, because you've all been following it, our number of positive COVID-19 cases continue to rise in New Orleans and in the state, as well as across the country and world. Within the next week, we are expecting a dramatic rise in cases due to large batches of testing coming back, large numbers of results coming back. We've been expecting this as we expand our testing, and the expansion of testing is a good thing. But these numbers will be very sobering and will continue to indicate what we already suspect, that there is substantial community spread of COVID-19 in New Orleans. The rate of infection here, the rate of cases that we are seeing is increasing much faster than many other cities. That's why earlier this week we took aggressive action through the mayor's order to limit further spread and strain on our healthcare system. And we are strengthening this mandate today with our stay-at-home guidance. For these reasons, as the mayor said, we are mandating that everyone stay at home except for essential needs. This is absolutely necessary to limit contact between people. Do not leave your residence except to fulfill essential needs like getting groceries, go to the doctor, working in an essential service. Do not host gatherings at your home. You can go outside for recreation, and we know we all need to blow off some steam, but do not do so in a group, and do so in accordance with our social distancing requirements. Remember, essential businesses will remain open, so there is no need to rush to a grocery store or pharmacy. For businesses, if you cannot perform your function without touching people, you should be at home. I can't stress this strongly enough. I am proud to announce today that New Orleans was the first city in the nation to roll out a federal drive-through testing pilot program. This is a program led by the U.S. Department of Health and Human Services and implemented by the state and the city. Through the pilot, we have 2 drive-through sites in Orleans Parish, with the 3rd site in Jefferson Parish coming online soon, and fantastic cooperation between parishes and within the state. You've seen field medics with the Louisiana National Guard here on the ground assisting in the administration of the program. Per the guidelines set by the feds, the testing sites will initially focus on our symptomatic healthcare workers and first responders who are working around the clock to provide care, compassion, and safety to our residents. It is our intent that the criteria will soon be expanded to include additional symptomatic high-risk residents. I cannot thank our team at the Health Department, at the New Orleans Office of Homeland Security, the National Guard, the state, the governor's office, everyone in between for the planning efforts that got this program off the ground in a matter of days. That is unprecedented, and we are the first in the country to be able to pull it off. We look forward to doing our part to expand testing citywide. Again, I cannot stress how important the instructions we are giving to you. Every single person plays a role in the health of our community, and the decisions you make today will save lives or they won't. When you do leave your residence for essential services, avoid close contact with others, wash your hands regularly, practice the social distancing we've all been preaching. If you work in an essential service, we need you, and we need you to take precautions to prevent the spread. This is not unfamiliar to us as New Orleanians. We know how to do this. We know how to handle storms. This is yet another challenge to us. Stay home, hunker down, call your loved ones, donate or volunteer to help others if you are able, as we have seen such an outpouring from every segment of our community. We will get through this together. Right now, coming together means staying apart. Think of your healthcare workers on the front line. They're staying at work for you, so please stay home for them. Thank you.
I like that.
I didn't think it up.
No, I like that. That's I like that. And it cannot be overstated how hard our healthcare professionals, the Guard, Homeland Security, have all leaned in to even stand up the drive-through testing sites that opened today at 7:15 a.m. and we got it done in 3 days. And had challenges along the way, as I articulated, but we were able to work through them. And I have to thank our congressional delegation federally who worked with us again to ensure that we not only stood up those drive-through testing sites, but also we were able to be granted flexibility of expanding labs for testing. And so with that, even our partner Ocean, for example, is now able to begin lab testing, and they have the capacity, I understand, to test and to move forward 800 per day, which is huge for the city of New Orleans. So we want to thank our partners in that regard. As it relates to, we call, and I want to say the Sewage and Water Board, I have our Executive Director, Gassan Corbin, who is with us and who will come to speak before you. I have made it very clear, even in my mandate, and I'll clarify, the mandate was issued, the proclamation, on the 16th and not the 15th. But a part of the proclamation and the mandate clearly defines that our sewage and water board employees are on the front lines as well and are considered first responders. Gassan Corbin will come forward and speak to some of the issues as well as some of the directives that are coming down from the Sewage and Water Board. Gassan?
Thank you, Mayor. Good afternoon, everyone. Much like the Mayor started her comments today by acknowledging and thanking our employees, I want to do the same. I want to acknowledge and thank the Sewage and Water Board men and women who have showed tremendous amount of dedication and loyalty to serving the public day in, day out. And many of them have reminded me that they've had a lot of disasters and catastrophes and situations much like this or worse than this under their belt, and then they stand ready to serve you as we face this crisis. Today, I'd like to share a couple updates regarding to the Sewage and Water Board and where we stand. I'm here to tell you that our operation continue without any major interruption. We are providing drinking water and treating wastewater for every household and business in this city. And with rain coming this weekend, we are ready to respond to that event and beyond. The COVID-19 pandemic has hit home. It has hit our Sewage and Water Board family. We have employees who are quarantined. We are up to 45 total employees who are either tested positive, who are directly in contact with these patients. And out of abundance of caution, we have sent several home just to protect them, keep them safe, and keep the rest of us safe so we can continue to serve the public as we move forward. Our call center and our meter reading departments have been especially hit hard. We are practicing social distancing the best we can and trying to keep our employees from congregating in groups of no more than 10. For our customers, this will translate to longer wait times and far more frequent estimated bills. We know that this will further exacerbate the situations in the future, but this is very unavoidable at this time. We are looking to ease the wait time for our customers by creating an opportunity for customers to leave a voice message, and our staff will get back to them as soon as possible to address their concerns. This may be implemented as early as Monday morning. We continue to do our part, so in addition to our social distancing, we are also disinfecting our workspaces to protect our workers, to keep them safe. Our workers, as the mayor has acknowledged, and thank you, Mayor, for your leadership and support in this, because it means a lot to our workers. They are right up there with police and fire in providing critical services to keep our city safe. We have adjusted our field work to focus on the most pressing emergencies that could cause water outages. Again, our mission is to keep clean water for washing hands flowing without interruption to as many customers as possible. We have had to respond to an increasing number of sewer clogs since the pandemic began. This is avoidable. Please do not flush wipes down your toilets. This may sound whimsical to you, but this is very serious. Wipes clog pipes. Remember that, and we want you to continue your hygiene and wiping your surfaces and keeping your family safe and healthy, but remember, wipes clog pipes. One more update. We have suspended shutoffs, as you all know. We are working to restore water services to delinquent accounts so far to all of our residents so they can wash their hands and practice safe hygiene throughout this pandemic. But at this time, I also want to make a plea to our customers. We continue to provide you with services, and that costs money. And while we won't shut anyone off, please do what you can to support us by paying your bills. This is very, very crucial at this time. You can pay either online or by calling us, or you can put your payment in the mail. This will help us keep going through this very difficult time and prevent you from facing a big bill when all this is done. Thank you very much.
Thank you, Ghassan. Thank you, Ghassan, for that, and which was a great segue, actually. We, as the city government, are urging our businesses who are still operating, meaning those essential businesses, grocery stores, hardware stores, and the like, to do the best that they can to remit their sales tax to the city, because it does have an immediate impact on our cash flow and our ability to provide basic city services. But this is a great segue. I'm going to ask my CAO, Gilbert Montano, to come forth, and we'll go just a little bit deeper as it relates to, one, moving government to limited operations. Gilbert?
Thank you, Mayor, and I want to carry out the sentiment. You know, our operations are stabilized through thoughtful and prudent financial management, and that's why we're leaning in so deeply to ensure that the public safety teams are able to operate and we're able to address and combat COVID-19 with as much resources as possible. And because of that decision, we're having to be very thoughtful and calculated with our methodologies on how we're deploying some of our resources. As we said earlier in the week, the city does have a concerning cash position that we're watching very closely, and then a long-term deficit that we'll have to face, as all other businesses will have to face. We finalized some of the methodology and modeling over the course of the recent nights, and if we carry on without having a specific finite period toward where we're going, the city's looking at over $100 million deficit, and that's a significant number that we have to start thinking and preparing for very early. Having said that, as we articulated, both from a public health perspective, but also from a financial perspective, we have to look at going to a limited government operations. It's very different than what we had prepared or thought through hurricanes versus essential and non-essential employees, because we do have and will maintain a normal government operation at a limited capacity. So certain agencies will be scaled down, certainly with both resources and bodies. We are in the process, as the mayor said, having our directors evaluate what that means for the everyday public. Then we will take the next stage moving forward to determine what the next financial decision that we'll have to make as a city and as an organization to maintain a strong cash position in the short term, this temporary period to get us through, but then also as we, in the backdrop, understand where we're going for the overall deficit, and ensuring that we're prepared to meet those challenges, but starting, as we said earlier this week, by a spending and hiring freeze that we did implement. I can't say how vital some of these government operations are in the midst of this period, and making sure we're being thoughtful and wise for this indefinite period is one of the most important factors that we have to maintain. But for financial stability, we will not be able to deploy some of the resources that we are currently deploying. And so we want to really punctuate to our staff and to the public that limited service is going to mean limited service. We are going to have to scale down operations. People are going to have to stay home. We are going to have to make tough decisions moving forward. Now, in the same vein, to the 1,000 employees that we have out there, we are doing everything we can to avoid layoffs and furloughs. There's a lot of financial management tools that we are going to be able to implement. There's a lot of cost reduction plans. There's a lot of different scenarios that we're modeling, that we're dealing with, that we're projecting currently. But I don't want to alleviate the concern that at some point certain decisions will have to be made that may involve those decisions. I think it's open and transparent and fair to be very straightforward with what we're thinking about and what we're contemplating as a final and last resort. Once again, to maintain the financial stability to provide the operations necessary to combat this major issue. That's the holistic perspective that I wanted to articulate as far as limited service. What that means is that most core functions within city government will be operational at a smaller and limited capacity. Everything that you did 2 weeks ago, you should be able to do via online or via phone call. Nothing is going to be completely closed off. It's just some of the external agencies that are currently not activated within this limited service plan that we'll be evaluating to make tough decisions moving forward. And I'm happy to address it through questions. Thank you, Mayor.
Yep, thank you, Gilbert. All right. So we will go into Q&A just based on this stay-at-home mandate. Residents and the like can anticipate increased enforcement. All of our police officers, regardless of deployment, on Monday have been mandated to be in uniform. And we have created various task forces as well, made up of our officers. And Chief Ferguson remains focused and very vigilant as it relates to seeking and maintaining law and order throughout the city of New Orleans. So with that, I'm going to take questions and answers, and we'll do so collectively.
Madam Mayor, we have Fox 8 followed by WWL.
Yes, Mayor. How does the city plan to enforce the mandate, and then what will be the consequences and repercussions for not staying at home?
Well, most of it on the front end of this is personal responsibility and adhering to our people to do the right thing, stay home and save a life. As it relates to businesses that are operating that should not be, they're subject to not only being closed down, but losing their license to operate in the future in the city of New Orleans. We are making sure that we beefed up enforcement across the board that just doesn't come through the New Orleans Police Department. Code enforcement as well as safety and permits as well. But we are geared up and we are prepared to enforce at every single level.
What will this enforcement look like?
What it will look like is police officers on the ground writing citations, code enforcement doing the same, visiting businesses as they've been doing over the past couple of days, but seeing a great response, I would have to say, from the businesses that they do have to, or where they have visited. Even as it relates to breaking up large gatherings with individuals, stepping to people, and the approach matters, and always ethical policing practices, always top priority for our department, and as well as for our other departments such as code enforcement and those who will be making sure that we're holding people accountable. And so enforcement, it will happen as it's been happening.
Fox 8, I'm sorry, WWL.
The governor indicated yesterday that we were 7 to 10 days from critical capacity levels at the hospitals. There are some reports from doctors and nurses within all of the local area hospitals that we may already be there with a shortage of PPEs for the nurses and doctors that are treating some of these, and a lot of the rooms are already full up with some of the patients who have comorbidities with this. Can you give us an update on how the area hospitals are looking at this point?
Absolutely. I'll have Dr. Avegno to give you an update in terms of how we're experiencing it here in Orleans Parish, but also understand that we have been identifying surge capacity for over a week now, and we have been able to stand up and are prepared to stand up multiple locations. But Dr. Avegno, you want to speak to the existing conditions?
Yes, thank you. We are monitoring that. We, the state, are monitoring that on a daily basis. Right now, we have beds. Right now, we have ventilators. Right now, we have ICU beds. But again, my colleagues on the front line know this before anybody else. They are being very creative at hospital systems. You've noticed that UMC has set up a surge tent in the front, and finding ways to limit the number of PPE that gets burned through by doing other measures that are still safe and still taking care of patients. We have requested PPE at every level, and we continue to do so every day. We are getting some. I know the hospitals are doing the same, and we will continue to do that. We've called on the feds to increase production, which is something that the president can do, and we will continue to be tireless to do that.
In the meantime, there's been some traction online about some of our local craftspeople getting together
Yes,
and
I was
sewing
about to speak to
face
that.
masks and gowns. Is this something that they should be doing? Does this help? I know Covenant House has said that they could use some. I'm not sure about some of the other hospitals. Can you address that? And if there is a centralized way that people can start donating
Sure.
their time towards this?
So my mom is actually one of those people doing that as we speak. I think anything that rallies the community and allows them to help in the effort. This is like World War II, right? This is that Angela Merkel said it best. This is a challenge like World War II, and everybody's got to do their best. Are these surgical masks going to be hospital grade? Probably not. Might they in some capacity be useful? Absolutely. And so if that's folks' passion and they want to help, then we support that.
Absolutely. And our Director of Cultural Economy, Lisa Alexis, is front and center on this, is organizing our creatives, our cultural bearers, and we are really working on a mechanism to, one, give them jobs to do, and this ties in very nicely with how we want to put our creatives to work. And it's a win-win all around. And so we are not only exploring it, but we're moving that forward, and we'll have more information in terms of what does that look like to you soon.
And I just got one more.
Mhm.
The Louisiana Department of Health website indicates that there's a disclaimer saying that private testing groups are not going towards the overall numbers. Will that be the same for the drive-through testing facilities? And what steps are being taken to make sure that we have the most accurate amount of numbers?
Speak to that, because you get in that overall numbers.
I can speak to that. Again, we are starting to get results of commercial testing in. They have come in slowly. I know that the Office of Public Health at the state has asked each lab to report all of their tests. And so I'm hopeful that asterisk will be removed. In terms of the drive-through pilot, that is one question we have asked the feds over and over, and they have assured us that their mechanism will allow reporting of those tests to the states.
Because
And
the
capacity
data-
at the drive-thrus right now?
So right now, the drive-throughs, there were 2 sites in Orleans. The site in Jefferson is expected to be online tomorrow. 100 tests per site, per day.
Yeah. And ours started off seamless, and it's continuing on that path towards the afternoon. So we're happy about that. What else we have?
Just want to get clarity on something here. It sounds like today's mandate is mainly guidance about the restrictions the other day. No additional businesses are being shut down. No additional restrictions are being put in place. Correct?
No, there are additional. Based on the guidelines, it speaks very clearly to non-essential businesses. All non-essential should be closed. And that speaks to beauty shops, nail salons, barber shops. It drills down deep. But it speaks to only essential businesses that should be operating at this time. People should stay at home.
So will barbershops and beauty shops and those lose their licenses if they're operating?
Well,
Or is that more of a personal
no, that is across the board. Any business that is not following this proclamation, these mandates from the city of New Orleans, stand to be impacted negatively in terms of their ability to operate in the city of New Orleans. Now is not the time. This is about saving lives and flattening that curve. And we have yet to see our curve. And so we know that the negative impacts are real in terms of the business, to their patrons as well. But it's imperative. It's vital to our ability to stop the spread, to flatten that curve. And again, a curve that we have yet to see.
Is that indefinite, or is there a timeline?
Nothing is indefinite, but we will continue to assess week to week. The data is so important, one that you asked about, Steve, and if we have accurate data, then we're able to make the best decisions possible based on that data. as things change and they're in the best interest of the city and our people, we will make adjustments accordingly.
Yes, ma'am. And also, Mr. Good would be free to answer this question.
Sure. What's your question?
Hotel managers are saying that they're taking a big hit, lack of filled rooms, and having to lay off staff.
Mm-hmm.
What kind of support can you expect? What kind of support can they expect from local and state officials?
Well, I mean, in regards to our hotels, our industry, absolutely they're taking a big hit. Occupancy is below 8%. The airport is like a ghost town. It's a fact. We're all taking a big hit. But in regards to what can we do, what can city government do, I think we've done it. We have relaxed fines and penalties associated with paying their taxes or remitting their sales taxes to the city. Again, it's a big hit to the city in terms of our operating budget, but it's one that we're willing to take to float our businesses so that, one, they can operate as long as possible, as well as provide resources and services to their employees like PTO. And so that's a big adjustment and a way that we're meeting them where they are and asking, again, those businesses who are not as impacted by this mandate that they remit their sales tax to the city in a timely manner. And keeping in mind that the sales taxes that are remitted to the city are not all towards our operating budget. The city of New Orleans is a pass-through, and other agencies will be impacted by the lack of sales tax remittal.
Appreciate it. This is for the doctor, if it's okay.
What's the question?
The question would be, have pediatric hospitals seen an increase in young patients and their parents concerned about,
our babies?
Yes, actually, I've been in discussions with Children's Hospital, and this is consistent with children's hospitals all over the country. They have been incredibly proactive and understanding this disease and talking to their colleagues. And so they tell me that at Seattle Children's, which should be the ground zero for anything pediatric, they are seeing almost no cases of COVID-19 in their children's hospital. Our children's hospital as well has not seen any cases, and they are being very judicious about who they test, because we know that kids, and this is consistent country to country, kids who get it get very mild and do not do poorly. And so in their mind, it is critically important to save personal protective equipment and save testing for those adults who are far more likely to be severely ill. However, they're doing a fantastic job of educating parents, calming parents' fears, and making them understand sort of the true nature of this disease. And so this is maybe one of the bright spots in this whole pandemic, is that our children consistently are not seen to have serious complications at all.
One more, please. How are the drive-through testing sites working overall?
Great. Well, we are all excited about it. I teared up thinking about it, all
too.
the hard work.
It was phenomenal, I have to say. Our teams really pulled it together, directed the operations on the ground. This morning there were lines of 25 cars at each site, and it was people who truly needed it. And I want to thank the public for this so tremendously. Everybody heard that we are only testing symptomatic healthcare workers, and that's who showed up. It was amazing. And so each site got to their 100 test capacity within the first 5 hours. And so I couldn't be prouder of our team, Mayor. I don't know if you
No,
wanna-
it's true. No, it's exciting. And also, I did want to add, as I was thinking about them and thinking about the hospitality industry, we've included even our employees that we're depending on to keep those businesses open. They're essential personnel to those businesses, and they're on the front lines, and so they're being included as well. So with that, LaTanya?
Like you said, what city services are being reduced?
City services in terms of being reduced. Now, this goes really from department to department, and we are taking time to evaluate this right now as it relates to those limited personnel who are just essential to making sure that basic city services continue. One of the examples I can give you is that, we're keeping infrastructure work going, right? This is something that has to continue to move forward. Green infrastructure, all the joint infrastructure work. So under this particular mandate, and as we're looking from department to department, it means that project delivery unit is a priority. It means that finance is a priority. It means that procurement is a priority. The Department of Public Works, community development, how we're standing up and providing real services to our creatives. It means that cultural economy, is a part of that. When during a hurricane, maybe not so much, but in this instance, absolutely, because we want to keep people working as best as possible. So it is a thorough evaluation, literally from top to bottom up. And we'll have more information of what our limited capacity will look like in the days and coming. And as we get prepared to limit government, but at the same time, stand up access to government by being accessible virtually, and online and using that internet and that sort of thing. Jeff, I think you had something.
I'm just curious, do you think that, or do you consider this move toward additional restrictions, is that more shelter in place, or is that something that...
It is a shelter in place. It is a stay at home. It is only come out for essential services. That's what it is. It's what was in place. Even the last we did it was during Barry, when we were expecting Barry to come our way. But it is what it is. Stay at home. Work from home if you can. Only go out for essential services. And those businesses that are essential will be those that are open. And also, and the governor mentioned this to me as we were making sure that these essential businesses like grocery stores and pharmacies and the like have access to commodities. And they do. So there is no reason for people to feel like they need to just stock up and pile up. There's enough, and we can ration it out. You can go from week to week, but there is enough so that all of our people will be able to purchase those essential items that they need, that all of us need. And no one is better than the next person. So with that, just really, think about the spirit of empathy, gratitude, and it takes us all. We really are all in this together. If there are no further questions, I just want to say thank you again so much. I also want to just give a big hug, virtual hug, to our education community. Those who have fed thousands of our young people and our family throughout the city of New Orleans. That is an essential service. Those of them, of our educators who have been working tirelessly with our young people being at home. And even those are doing virtual learning. And I had the opportunity to oversee my daughter who is, in the classroom virtually every morning at 8 and ends at 3. But how they have been able to keep these young people engaged and making sure that if they are virtual learners, that they're being called on, read that paragraph. It matters. And so I cannot thank our educational community enough. Also, as it relates to our higher ed community, and I have a call with our presidents and our chancellors, had one today, and working with Senator Bowie on this as we're asking the governor to really speak to the Board of Regents to get out a mass messaging to our student population who have seemed to be some of the hardest to comply. Still trying to gather at the fly, and I know it's spring break and all that, but that is not permitted, and it doesn't save lives. And so we're going to work very effectively on that messaging so that our students, and we do recognize that we have students who have come home, so they may not attend schools locally, but they're still our people, they're our young people, and they're students. And so as I told the university presidents that their voice matters here, even if the students are in their institutions. Yes, sir.
On that same note, I know a lot of people have asked me to ask the question, have you all already had discussions? I'm sure the medical community has, about the people at spring break. We're pretty much trying to drop this curve. They're going to come from Florida, where this is obviously going to be spreading around, and now they're going to bring this back into our community. What's going to happen then?
Well, that's where the messaging comes in. Stay at home. This is not a time for a party. Stay at home. But we also know that many of our young people, our students who are residents of New Orleans, have returned home. And so I think that a unified message from the Board of Regents will speak to our young people across the board to listen, to do the right thing. And listen, as a parent, we all need that voice of another parent to just reassure that your parents are telling you the truth. And so, you know, it takes a village. And we'll continue to echo that message. Anything to add on that regard, Doc?
No, I would just say, you know, spring break is canceled all over the country. So our college students have come home. We hope that all other college students have gone home safely. You saw what happened in Florida. But again, this is not spring break. There will be no spring break. Spring break can be virtual in your room or in your house.
Amen. We're mothers around here. We got a little strong in our voices when we started talking about these children. Lord have mercy. So with that, thank you all again. We will have more updates to come. Follow us at ready.nola.gov. You can access that even if you go to nola.gov. Sign up for text alerts, COVID NOLA. Text that to 888-777. And there are so many tools on that website, links and everything to resources that have been provided for the use of our public. So thank you again.
Thank you, Madam Mayor.
Hey, y'all, I've got copies of the additional guidelines. Thank you.